Hello, hello. Hello, dog lovers. We are here today to practice some cooperative care with Riker, my Beagle. He gets very loud and very squirrely when we try to hold him or when we try to do certain uh, cooperative care exercises with him, like trim his nails. So, today we are going to be practicing some cooperative care techniques, including getting his nails trimmed. So I've got some bulk treats here that he loves. Say hi, Riker. You can see he's excited. He does love training time. Riker. He uses the couch to get up on top. Whoa, careful, careful. Usually with a little bit more grace than that. Oh, he likes to lay down on something a little bit padded. Good boy. I've got my other dog, Suki, here, who will get an occasional treat. Good boy, Riker. Touch. Yes. So we're going to work up to having him do some cooperative care stuff by doing some of the basic obedience things that he knows well and is comfortable doing first. Down. Yes. Good boy. Good girl, Suki. That was a good down. Sit. Yes. Good boy. Down. Yes. Touch. Oh, come on, touch. Yes, good boy. Good job. And sit. Very good. Very good. Girls. Good boy. Okay, now I'm going to bring out the nail trimmers. I'm going to have him touch these before I try touching his paws with these. Touch. Yes. Good boy. So he knows exactly what we're doing. Touch. Yes. Good boy. And then I'm going to ask him for down. Good boy. And we get several treats ready. And I'm going to put them where he can see them, but can't reach them. No, he can't reach them either. And then I'm going to pick up a paw. Yes. And if he lets me do it, if he lets me get the nail trimmers close to his paw, then I will give him a treat. Yes. I might hold his paw just a little bit longer because that's the stage that we're at. Yes. Good boy. Break. Break means that, okay, we're going to go to the little less than break. Hold on. Off. Off. Okay. And so taking that slippery thing off so that you're not slip and sliding around all the time. There we go. We'll put that back on later. Good boy. Yeah, that has a little bit more grip to it. Okay, good. Yeah. So he and Suki have both learned that if they wait patiently near me while I break up treats into smaller pieces, that eventually they will get a piece. This keeps them from getting pushy. You're being a little pushy, sir. Right there. Back. And that's down. Okay. Good boy. You did give you space. Good job. Okay. Lay down. Good job. Put some treats on my thigh, outside of his reach. Yes. Good boy. And now we're going to go in for our first trim. Yes. Good job. Good boy. Square off that nail. Good boy. So thankfully, Riker's nails are white, so I can see where the blood vessels are. I would be going a little bit shallower and a little bit slower with a dog with black nails until I figured out where the quicks were. The quick is the part of the nail that that has all the blood vessels and the nerve endings. So he can't feel, other than feeling something touching his claw. You can't feel me trimming the pieces off. He's being very good today. Usually he needs a little bit more frequent breaks than what he's allowed. Yes, good boy. Break. If I don't give Riker frequent breaks to go and run off and take a break, then he will stand up and start screaming at me, and nobody wants that. Beagle screams are quite loud. They were made to be heard throughout a forest, a densely wooded forest, as they chased foxes or rabbits or other prey. Now what we have here is what's known as a start button behavior. Riker knows that I'm not going to chase him down if I feel he needs to have his nails trimmed and he doesn't want his nails trimmed in that moment. I'm not going to chase him down. When I say break, he gets a break and he gets to decide how long that break is. When he is ready to re-engage with the training, he can come back up here and lay down again. And that tells me that he's ready for his next nail to be trimmed. Good boy. So he gets some treats for coming back. And then we make a little snip. Oh. He jerked back, so I'm going to pause. I'm going to wait. And then I'm going to try again. Yes, good boy. Yes, good boy. That was a big snap. Very good. Oh, his butt came up, so I'm going to wait. There we go. He relaxed again. He's back in his start button behavior. He's ready to continue the training. So I'm going to give him a treat for that. And every time I trim, I make a snip of any size, big or small, I'm giving him treats. That's because we're still pretty early in his training here. We've been working at this off and on about once a month for 2 years, because he's 2 years old, or 2.5 actually. And so we've been working on this off and on. Some months I was doing more work than others, and if I missed a month, then we would backslide a little bit. So you saw him jerk back. I'm gonna wait. There's no moment to think about it. Good boy. Okay, again. Yes, good boy. So he's getting a little bit fidgety. So I'm going to do one more snip, and then I'm going to give him a break. Oh, he took his paw away. So he says, but we're done with that paw for now. He still wants to engage, he still wants to be part of the training process, but he just wants to work on that paw. So I'll take a break, and I'll do this paw. Good boy. Break. Good job, buddy. I normally use a what's the matter? There's a squirrel in the yard. Suki, touch. Yes, good girl. Touch. Yes, good boy. I normally use a bath mat up here because it's got less of a slippery surface on the bottom and it's nice and cushy. However, I couldn't find where I put the bath mat, so I'm using a blanket instead. Now he's up on the platform, which is actually Suki's crate, but he's not laying down. So that tells me that he's not ready yet. He's not doing his full start button behavior. There we go. Good boy. Wait. All right. Good job. Now, with some dogs, when you're working on cooperative care with their nails, it's easier to start on the hind nails than it is to start on the front nails. A lot of dogs are more sensitive about the front paws because they can see them, whereas the back paws they're a little bit less sensitive about. So if you get sensitive about me doing this front paw too, I might use his back nails. Yes, good boy. Did I even get that thumb? You saw his butt go up. He's considering bolting. That's okay. This is all about trust. Cooperative care is all about building trust and going at the pace of the animal that's in your care. Now, there have been times when I forgot to trim Riker's nails for a month and his nails got really long and I had to trim them back, and it was very important that I do so quickly before they got longer. I was sick or had a family emergency and wasn't able to trim his nails for a month, and that's okay. In those moments when I have to get his nails done, I do not do this. I take him to a different room and I wear different clothes and I hold him down and I get them done. And we are both very upset about that. But it's medically necessary for him to get his nails done regularly. It's not safe for him, and it is not, it's going to cause him pain and discomfort to have his nails too long for too long, which is why we do this training. But if I tried to do this training in a time when I had to get his nails done all at once and it had to get done right then, I would not be doing this, because I do not want to poison his opinion of this exercise. Good boy, break. I do not want to poison his experience of this exercise and set us back even farther and break this trust that I have built with him by doing something that is absolutely necessary and using the training at the same time. I have to take him to a different room. It looks different. It feels different. There's no treats involved. I just hold him down and get it done. Everybody hates it. He cries, I cry, no one likes it. But it's medically necessary and it is a safety issue to get his nails done regularly. And because of that, because I do that, because I make it look so different, this training does not backslide when I do that. It backslides if I don't do it for too long. Oh boy. Okay. We say no to that front paw again, so I'm going to do a back paw. Good boy. The angle's different, so that required a little bit more concentration on my end. Good boy. Yes. That was so good. That was a big chunk. Good boy. Good job, buddy. But yes, he'll get a little bit less. Oh, that would hit me in the face. He will get a little bit less cooperative if I go too long in between training sessions. However, the full-blown trust does not get ruined by me taking to another room, forcing things to happen versus the training sessions. Ready? Okay. Break means he's free to decide what he wants to do for a little bit. The option is still here, and you see how quickly he comes back now, how much faster that is compared to what he was doing at the beginning of the training session. Good boy. Now we might take a break from nail trimming and do a different kind of cooperative care in a little bit. First, I'll see if I can get a little bit more of that back paw done. And I'm just mentally keeping track of what claws I've done. I've done all of his left front except for his thumbnail, his dew claw. I've done the dew claw and one of the nails on his front right, and I've done two nails on his hind left. and I will pick up next time we do this with the nails that I didn't get to. Yes, good boy. Sometimes I can get all of his nails done in a day. Often I just have to take 2 days in a week. There he jerked and sort of got up, so I pulled back and gave him space to think and calm down. Here we go, head down. Yeah, good boy. I did not see that. He does not know that command. I was just commenting on what he was doing. But when his head goes down, I know he's ready. Good boy. Very good. Okay. Are we going to switch to something else now? We got 3 nails on that back left paw. Good boy. Okay, great. Let me see. I'm going to check one more place where I think I might have put the bath mat. Let me see if it's in that last place that I forgot to check. Nope, not there. Let me check one more spot. Okay. So now ready? Great. Hold on, buddy. I know. You're very excited. Right. Oh. Yes. Let me get it down, bud. He was very excited when the what's it called? Bath mat comes out. Okay. So now we're going to do some cooperative pair holds and some practice with a foxtail hood. Now we have a foxtail infestation in our backyard. Foxtails are nasty. Good boy. There's his frustration bellow. That was him going with the talking at the computer and just trained me already. Good boy. Foxtails are a really nasty sort of wheat plant that grows naturally here in California. And it is notorious for getting into dogs' gums, nose, eyes, and in between their paw pads, digging in and bringing in infection. It's really hard to get one out because they are barbed and they only go one direction, and that is forward. So it's very difficult to get them out once they've been dug in. Riker has in the past had 2 go into his nose and 1 into his eye. And so he has an outfox hoodie to go into the backyard. This is a hood that goes over his face. We've attached it to a collar. And it goes over his head. And it is a nice mesh so he can smell, he can see, he can breathe, he can pant, he can even eat and drink I can toss treats in next to his ears and they fall down into the bag. So I can toss treats in and they go down into the bag. And he can eat those. He can also drink while wearing the bag. And you can see he gets very excited about putting his head in. Make sure his ears are in all the way. And then I'll take the collar and I'll put it around his neck to hold it in place. Good boy. Good job. Wait. Good job. We're still practicing, figuring out how treats work with the hood. No treats. There you go. Good boy. So he took to this in about 2 or 3 days. And now he wears it all the time when he's outside to keep the foxtails out of his nose, which he sticks everywhere because he's a beagle. That's what beagles do. They stick their nose creases. They follow their nose. So that's one of the things that we've been working on. We've also been working on preparing for eye, nose, and ear exams. Sit. Wait. Sit. Let me see. Yes. Good job. Sit. Let me see. Yes. Good boy. Let me see. Yes. Good job. Let me see. Yes. Good job. Okay, great. Uh-oh, did the treat get somewhere where you can't get it? Oh, good boy. Fix it. Good job. We've also been practicing a few veterinary holds. This is holds that vets will need to give to him to give vaccines, to draw blood, to, look at different parts of his body. So we're going to do a few of those. Riker. Oh, good boy. So first is holding the head and holding the forehead. And I'm take a break. That's okay. Touch. Yes. Good boy. Should we do an easier one? How about chin? Yes. Good boy. Chin. Yes. Good boy. Chin. Yes. Very good. Very good. No, you can't cheat. Come on. Good boy. Sit. Yes. Wait. Let's do head hold. So I put my arm along his back and where the base of the skull meets the spine, and I lift his chin up to bare his throat. Yes, good boy. And that's for throat examinations as well as for blood draws. Sit. Ideally, we can do that in a sit too. Yes. Good boy. Very good. I know that was hard, huh? Let me try the body hold again. Yes. Good boy. Yes. Good job. Great. Oh, you need help? That one went through the cabinet. Done. Lost treats around the Beagle for a trap seat. There you go. Okay. Ready? Gotta love the enthusiasm of a food motivated dog. Good boy. Next, we're gonna try some blood draw holds. Riker is losing his patience. Good girl, Suki, thank you for being quiet. Good job. Good boy, Riker. Okay. Down. Good boy. So one of the common blood draw holds is for the dog to be in a down. You lean over them, grab their elbow, straighten their front leg, and roll their leg from the inside to the outside. They lay down. Good boy. Yes. Good job. Yes. Good boy. You can see he's not very comfortable with that. He's very much resisting, but he's letting me do it, and that's the first part. Okay, he's not letting me do that anymore. So, down. Roadkill. Roadkill. Touch. Roadkill is the cue for getting him to lay on his side. You might not want to because the it's a little unstable. Roadkill. There we go. Good boy. Roadkill. Yes. Good boy. Roadkill. Yes. Good boy. Roadkill. Roadkill. Yes. Very good. Roadkill. Yeah, that was very good. Roadkill. 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 So we don't want to hold it. How about roadkill this one? Roadkill. Okay, spin. Twist. Sit. Yes, good boy. That's sort of his reset behaviors when he gets too anxious. Riker likes to move around when he gets anxious. So we're going to try a couple more times. Spin, twist, sit, yes, touch, yes. Good boy. Touch, yes, touch, yes. Down. Good boy. Here. Roadkill. Roadkill. Yes. 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 Break. Good boy. There we go. So roadkill is going to be helpful if we need to do a blood draw from a back limb. I tried using roadkill originally to get him to let me trim his nails because it's a lot easier to see where the clicks are from underneath the nails than it is from on top of the nails. However, I broke his trust with roadkill, and you saw just now how hard it is for him to trust me enough to hold that position. That's because I accidentally nicked him and it hurt one time about 8 months back with roadkill, and he has not trusted me to do it very much since. So we are trying to rebuild the trust with roadkill. Good boy. So another thing we've been working on is tolerating being pinched. Not hard, but just separating a piece of skin so that we can give a vaccine. Yes, good boy. So I'm not pinching to hurt. Riker has lots of extra skin. Come on, here it comes. Okay, Riker has lots of extra skin. You can see he has lots of extra skin. Good boy. He even likes it being massaged. He He doesn't have so much extra skin on his hind limbs, so we give vaccines only in his front limbs because he has extra skin here. Good boy, yes. Very good. So we've been practicing. Yes, good boy. It's called making a tent out of the skin. Yes. And that allows us to not hit muscle, and instead we're going to be able to put the vaccine underneath the skin instead of into the muscle, and it's going to be a lot less painful for him and a lot more comfortable for him. But you see, being raised like this, being up on a platform, he's a little bit less comfortable with me even just touching him. And so we've been working really hard on being able to get him switches being up on a raised surface. Good boy. Touch. Yes. Good job. You get a big chunk for that one. You're being so patient, Suki. What a good girl. Suki's a little angel. She rarely puts up a fuss of any kind. So, you don't have to do most of this stuff with her. Yes, good boy. Yes, good boy. Yes, good boy. Maybe the other side now. Yes, good boy. It's important to make sure that you're practicing on both sides of your dog and from standing on both sides of your dog for things like this. Because if you don't, if you only practice on one side, what happens is your dog gets used to only being on that side, and when the vet hospital is not set up that way, then you're more likely yes, then you'll have a dog that's panicking because that's not the way you practice it. So you want to make sure that you're practicing from each side of the dog, practicing using each of your hands, practicing doing everything on either side, and you're just getting a little frustrated and nervous, so I'm going to give you a break. He's coming right back. That's what I want to see. Good boy. Can you sit? Good job. Yes. Good sit. Sit. Good. Yes. Chin. Yes. Chin. Yes. Good boy. Chin. Yes. Break. Chin's one of his favorite behaviors, so since we're wrapping up, I wanted to do some things that you really enjoy. Sit. Yes. Good boy. Sit. Wait. Ready. Catch. Oh, good job. Touch. Sit. Chin. Yes. Good boy. Okay. Break. All done. Break. All done. All done. All done. All done means we're all done. Okay, well, I hope that you enjoyed this live demonstration of working through some of Riker's difficulties with him. And I hope to see you guys next week when we talk about something else. Okay, have a wonderful rest of your day.